So welcome. I'm Ann Cutler-Lanane, and this is the Wise and Wonderful Women. Just a couple of housekeeping things. Who is new here? Okay, there's a lot of new people. That's super cool. So the group is about 1,500 or 1,600 people on our mailing list. Facebook page, which is one of the things I want to talk to you about, probably about 1,200. But what's cool about the group is depending on the subject matter and what your availability is, because we usually do them during the week on different days, different people show up. And last month we had, 85 people in this room. So it always kind of ebbs and flows, and we've got somebody, actually, Eve, where's Eve? Eve came here during the pandemic, right before the pandemic, there you are, and now she's back. So anyway,
Even the pandemic couldn't keep me away.
Exactly, she's back. So anyway, so thanks for coming. So a little housekeeping in terms of what's on the table. So there are pads on there. If you are taking notes and you do it on your phone, I'm going to think that you're texting, and then I get all freaked out. I feel like you're bored, you're watching TV. So if you want to do it old school, there's Annie Gets It Done pens, because I am a real estate broker and have to put myself out there. So anyway, but they're the pads. Please take the pads home, take the pens home, no problem. But write down anything, because you're going to get some good information. But you're also going to get a thank you for coming email after you leave tomorrow or the next day, depending on when this video is edited. We are recording this, and we record all of our meetings, and that's important because there's subject matter here that you are watching that you might want to watch again. You want to send it to a friend. It's all there for the last 4 or 5 years. So you can go back, and there's a lot of different things that we have talked about that are really important and might not have been important a year ago, but they are now. So look back, because it's really very good information. And so it takes us a couple days to edit it, and then we will send you the thank you email, and there will be links for a lot of the things that we talk about today, but do write it down. The bios. Did you love reading the bios last night? Are those the coolest thing?
Those are amazing.
It's and that's something that's so different. I mean, there's a bunch of badass women in here, and we also have younger women in here. So my daughters are here. Jackie and Riley, raise your hands. And so this is certainly a topic that is really, really important, for people of their age, but for people of our age as well. But in terms of the bios, the reason why I ask where you live is because I also want you to ask each other out when you leave here, to be able to share a taxi, go in the subway together. So who lives on the Upper East Side? Okay, so just look out, see where you are, and share a cab or go home together. Upper West Side. Okay, Upper West Side, yes, okay, sorry. Who's here from one block, by the way? Nobody? Come on, nobody is here from one block? Yes, you are. I know there's people here. Anyway, it doesn't matter. That's another story. Okay, Upper West Side, we raised our hands. Downtown, Chelsea, downtown. Okay, look around. Okay, you're doing that just to make sure that okay, Brooklyn. Okay, we've got 2, look around you. There you go, you got 2 Brooklyn Queens. Okay, good, well, you're sitting at the same table. There you go, perfect. Okay, great. So you got that. If anybody's pivoting in their careers, if their daughters are, if they need any health information, they feel like they're going through some kind of crisis, anything, call me up, because we keep all of these bios in one master list. And I'm happy to say, let me give this to you so that you can find somebody that might be able to help you. Find somebody, a career that might be able to help you. It's just a great, great resource, and people put those bios in there to be able to connect. And it's just about being able to support each other in so many different ways. So speaking about supporting each other, this is so look at the cards that you have in your desk on here. Take these with you. There's a save the date for the next event, which is November the 18th. We're talking about traveling solo. It doesn't mean that you're going by yourself, but even if you're in a relationship, there's so many people that don't travel the same way, or they don't have the same schedules. And we need our women friends. And there's a lot of us that are single, and we want to go places, but we just feel uncomfortable about doing that. So there's a woman that started a group called Next Tribe, and she does these super cool trips all around the world with a wonderful group of people, and they even keep in touch after the fact. And then there's also Cindy Greenstein, who will help you use your credit card miles to get more miles so that you can travel for free. So anyway, we might also have another person that's going to be helping us, but that is going to be November 18th, so mark your calendars. Stay in touch, and the reason for that is follow me on Instagram. I'm actually going to be doing kind of a health journey. For many of you know, I had a heart attack at the end of May. I just have found myself in a position where it's like, I don't present to somebody that had a heart attack. But I was just kind of sent out to eat healthy and not have another heart attack. And it's like, wait, what does that mean? And some of the things that I was doing, I've realized with a very good functional medicine doctor that I'm doing the wrong things. So I'm going to be kind of on my Instagram just kind of sharing things as I go along, but just in general, my life is always falling apart. It's kind of crazy, so stay in touch that way. But there's the Wise and Wonderful Women's Facebook page, so you'll be able to learn about the events that we're doing and our speakers and what they're doing and sharing. And it's also a great resource if somebody's got a question. We always have women answering and trying to help out. On the back here also is Impact 100. That is a great organization of women only. And it's $1,000 a year, and what it does is it makes an impactful joint donation. So there's 350 women in New York City right now. It's a national organization, but in New York City, let's say there's 350 members, they'll make $100,000 donations to nonprofits. But we all choose, we all learn about the nonprofits, all make a decision about what to give. And it's a great group of women, so if you're interested in that, that's the QR code. And Proposition 1, you need to vote for it. And we are going to learn about that, but that is something you must vote for when you vote in November. So that is it. So with no more of a delay, let me introduce you to two wonderful women, and I'm having a panic attack because I can never, I'm like the worst speller in the world.
Aileen Garrity, like saline therapy.
No, you've really messed me up.
Aileen Garrity, like saline therapy.
I have it as, we spelled it out for me.
Yeah.
I have Garupe.
I mean,
no,
that's
that's how
fine.
I'm reading it. No, but I have therapy above. Sorry.
No worries.
So Aileen is a board certified OBGYN and director of the Complex Family Planning at Weill Cornell. Her clinical experience is in medical and surgical abortion, contraception counseling, and care for people with complex medical conditions and pregnancy care. The doctor provides reproductive care rooted in dignity, equity, and science. And in addition to her multiple degrees, her work has been cited with the late Ruth Gator? Gator?
She might have been an alligator fan.
Exactly, Bader Ginsburg. In 2014, the Supreme Court case on birth control access. So, welcome.
Thank you.
And Dr. Now, I didn't realize that it was Creatora.
I wrote it out for you.
Okay, Dr. Chris Creatora attended Barnard Harvard Medical School. She's a board certified in OBGYN and a clinical assistant professor at Weill Cornell Medical College, and is a certified menopause specialist. Do any of you need that? Now, somebody walked in and I go, it's kind of cold. It's kind of cold in here. She's like, I'm having hot flashes. I was like, good for you. Okay, good. And you serve on the board of the directors of Planned Parenthood Greater New York. Yes, Queen. She speaks publicly about sexuality, reproductive health, and human rights, and this year provided testimony for Amnesty International's report on abortion in the U.S. Welcome, ladies. I know that the two of you have spoken about what it is, and we only have an hour, and there is so much to discuss. So I want you to just jump right in because go right ahead. Jump right in.
Anyway, I'm very happy to be back again. The last time I was here was in 2019, also with Eve, right before the pandemic, and we spoke about what's untrue in female sexuality. So we're going to talk about more misinformation today. At that last meeting, we spoke about sexual health, and we debunked myths about female sexuality, which are prevalent in every culture. But we're going to segue into the landscape of misinformation and confusion that permeates all other areas of women's health, because it's sexuality, menopause, the true physiologic and economic impact of pregnancy, because abortion disinformation is central to this. Last month, those of you who were here heard Anne speak harrowingly about her experience. And she talked about how misogyny can influence medical care, and she presented specific instructions for us to protect ourselves. So self-advocacy is important, but we need the support of our healthcare providers, our family, our whole culture. All of this is essential to safety. And I really want you to know that I went into gynecology to address female suffering, to counter the normalization and acceptance of female pain, including violence against women, the physical and the cultural, and to expose the ignorance of things that just don't affect men. What Anne conveyed last month is that women's health needs aren't prioritized by a system that considers males the norm, and it treats females dismissively. Our calling as OBGYNs is to normalize abortion care and to provide accurate information and state-of-the-art medical services. So tonight we're here to educate about reproductive health care as preventive medicine that benefits the whole society, to help everybody understand how something that the culture stigmatizes and uses to create conflict is actually a source of positivity and freedom. So we're all abortion beneficiaries. I always say when I speak about being an abortion provider publicly that I'm not just a provider, but I'm a beneficiary, and I'm sure all of you are as well, that few of us could have the lives that we want without access to abortion care. So I would like to say that how anybody feels personally about abortion isn't really the issue. It's not the point. It's really who do you want in charge of making decisions about your health care. And at what point would you like it to be somebody without any medical expertise? So since we're talking about misinformation.
When you say the beneficiary of abortion care, specifically, I got pregnant many times, and I can't imagine having had a child at that age. It would have been horrible for me. It would have been horrible for the child. And yes, I could have given the child up for adoption, but that also takes your life in a different way. And I think the misconception, which is that I didn't have an abortion many times. It was more than once. But
whatever the number is okay.
No, exactly. But women are not using it as birth control.
No.
And there's also a variety of different reasons that will come up that are so at risk now. I had 4 miscarriages. One of those miscarriages, I didn't miscarry completely, and I was bleeding for over a month before the doctor finally listened to me because I kept saying that I knew that I was still pregnant, and I was still pregnant. And so in that situation now, I was able to have a D&C, of course, because I wasn't pregnant anymore. There was no heartbeat. But in the situation, in what's going on right now in our country, it is possible that I would just have to continue to bleed and bleed and
Pointing out
bleed.
that everyone in the community benefits from access to care, just like the women back there on the table who got to benefit from you choosing when to have them.
Right.
So we have so much disinformation about what abortion really is. Taylor Swift recently tweeted while she was doing her presidential endorsement that the best way to counter misinformation is to tell the truth. So I'm going to segue into the truth teller across from me.
Here we go.
Who's going to give us some facts about abortion.
I echo. Thank you so much, Anne and Chris, for inviting me. I'm so humbled to be here with all you wonderful, wise women. I'm sure that if you were at the front of this room, I would have so much to learn from you. Thank you for letting me be here tonight to share with you some of what I know. What I know is that women are smart and thoughtful, period. And they're smart and thoughtful about when the right time is to be a mother and when it's not. And that power and autonomy and that dignity is what helps to give us a life that we are under control so that we can realize our dreams and goals and those for our family and community, etc. 1 in 4 women will have an abortion at some point in her lifetime. 1 in 4 women. It is stigmatized, it is silenced, it is quiet. Not everybody feels comfortable enough, thank you, Anne, for sharing their personal story, because for so long this was something that we weren't supposed to talk about. And we've seen where that has gotten us. That has gotten us a very conservative Supreme Court that has quickly dismantled 50 years of reproductive health law that was otherwise protecting us. In general, for women in the United States, a heterosexual woman wants to have 2 children. She will spend 30 years of her life trying not to get pregnant. 30 years. I know there's other doctors, lawyers, real estate agents, career people, what else have you done for 30 years except try not to get pregnant? Like, it is a thing, right? Like, it is a major investment of women's time and energy in order to create that life. And contraception fails, right? The pill, which is still one of the most common forms of contraception, it was great. It was one of the earliest, most effective forms of contraception, going back to the 70s and 80s. But if you are a college student and you don't want to get pregnant, you would have to take 365 times 4, 1,200 pills. 1,200 pills to not get pregnant in college. Like, of course you're gonna miss one. Anybody ever pull an all-nighter? Did you ever go to Europe? I mean, I remember being on a plane being like, what time is it? Do I take the pill for US time? Or do I have it? Like, there was a lot of math that I wasn't prepared for. So this idea that women are somehow, again, I'll just say it in the positive, women are smart and thoughtful, and sometimes the tools that we have to protect ourselves against pregnancy when we don't want to be pregnant are not always adequate for our lives, and they don't necessarily align with our lives. The other thing I know is that abortion care disproportionately impacts people who are marginalized in our society. If you look at race, ethnicity, it's similar proportions of white women that have abortion, of black women, of Latinx women, of Asian women, etc. But because abortion disproportionately affects poor women, black and brown women, because of societal marginalization, redlining, whatnot, different topic, carry a disproportionate burden. But there's no difference in terms of race, ethnicity, and who seeks abortion care. There's no difference in religion of who seeks abortion care. Catholics, any Catholics in the audience? Our Father, who art in America.
I see the hands going like this.
Yeah, I know, same. Yeah. But no difference in Catholics, Protestant, evangelicals, Hindu, Muslim, Jewish. All the same number of people are, same proportion of people if you slice the pie that way, are seeking abortion care. But the other difference is in poverty. If you look at 100% of the poverty level, and hold on, I'm going to tell you this because it's going to blow your socks off, and I don't want to get it wrong. Okay, the federal poverty level. So we make policy decisions, et cetera, based on the federal poverty level. So for a household of 3 in the United States, the federal poverty level is $25,000, $25,820. 41% of people who seek abortion are below the federal poverty line. An additional 30% have incomes that are 100 to 200% below the poverty line. It is an economic decision whether or not to have children. And 60% of people who are having abortions have already given birth and are already parenting. They make the care and consideration over the family that's already here, over the children that they already have, in deciding whether or not the family structure, the economics, the living situation, etc., can welcome another pregnancy. And this doesn't mean that, surprises happen. There might be some happy cabooses in the audiences, or you might have some, but really the difference is whether or not you can welcome that accidental pregnancy, that happy caboose, whether or not that fits into the myriad of complexities of your life, and that really, again, should be individuals choosing. The laws that we have written, which Chris is going to be talking about, are written by legislators, not by physicians. They do not match up with the reality of abortion care. And we know that abortion care is health care. And I facetiously say at Thanksgiving, when my family, Catholic, likes to push back on that, I was like, do you know how we know abortion is health care? Because health care providers provide abortion. Right? It's not taxi drivers, it's not legislators, it's not, you know what I'm saying? Like, let's just look at the big picture here. So I think it's really important that we understand the facts, because there's so much rhetoric, misinformation, especially in presidential debates and in this time of national discourse. Every time abortion has been in the ballot in all of these states since Roe fell, abortion has won. Because men, women, everyone except for the legislators know that abortion is an important part of healthcare. The other thing that we've heard a lot about is when abortions are happening. This is the thing I want you to take to your meetings, to your subway conversations. 90% of abortions are done in the first trimester. 90% of abortions
Didn't
are
Phil say
done.
that there were post-birth abortions happening? I was like, wait, am I getting Like it was
He
like.
did say it. That's
like,
ridiculous.
yes,
As
no,
the moderator,
it has
folks-
to, obviously
Yeah.
it's ridiculous. It's like-
Yeah, it doesn't happen.
We're
And the
aborting
abortion, it's less than
toddlers.
1% of abortions that are after 20 weeks. And those are usually abortions either that are due to fetal anomalies, pregnancies that are incompatible with life or a threat to maternal health, or are due to a triad of delay. So teenagers who are just wishing it to go away, who don't want to tell their parents, who will often present for later abortion care. But it's less than 1% of abortions that are over 20 weeks. And then the abortions that happen in the third trimester are few and far between. There are no abortions that happen after birth because that's infanticide. And that is illegal.
It would be murder.
It would be murder, yes. So those are falsehood. Those are things to, pull at people's heartstrings. You might, the other two things I'll say is, the partial birth abortion, that is not a medical term. That was a term that was constructed to pull at the heartstrings of people, constructed by anti-abortions, because it gives you a picture that is not accurate, but it gives you a picture that makes us uncomfortable.
Yeah.
And the same thing for late-term abortion. It's not a thing. Term in pregnancy is defined by 37 to 40 weeks. Late term would be after 42 weeks. Again, if a baby is being delivered at 42 weeks, that's a delivery, it's not an abortion. And I'd like to give it back to you.
Can I just ask, I just want to just point out, just so we don't miss this. So you have a private practice, okay? So, and you are a wonderful gynecologist here in New York City. Can you tell me, so you're at Weill Cornell.
Yes.
Tell me what your program is, because I think, I just don't want to lose that in the, talking about because what you provide is terrific.
Thank you. I'm new to New York City, so if you see me on the street looking around, it's because I don't know where I'm going. Always help a sister out, please.
Just hold up a map, because any New Yorker, you hold up a map, 20 people will run to you.
Oh, that's
No,
amazing.
everybody will help you. And then steal your wallet.
Nothing in mind. I came to Weill Cornell 2 years ago because the chair of OBGYN at Weill Cornell wanted to create a section of complex family planning, of physicians who specialized in abortion and contraceptive care. That was something that didn't exist at Cornell before that. Chris and I are a little bit spaced out in terms of when we trained, but I trained in Philadelphia, my OBGYN residency from 2001 to 2005, and I could not get second trimester abortion training there. There was no of my attending physicians who were the teachers who were skilled enough to teach me that. So then I went and did
Hold on one
Yeah.
second. When you're talking about that, would that be, I go and I'm pregnant, I have a test, it's determined that there's a major problem with the pregnancy. So you're saying that doctors just weren't, it was very difficult to get a doctor that would be able to safely
Yes.
be able to terminate that pregnancy.
after 13 to 14 weeks, because it's a different procedure for first trimester versus second.
Because aren't you having an amnio it used to be 20
Usually
weeks.
mid-trimester.
Yeah,
But
18
what
to 20
I'm saying
weeks.
is that the procedures that are involved for first trimester abortion are different.
Different, right.
Different procedures than the mid-trimester. So she wanted to be sure she could get the training to do those
Right.
procedures, because we're doing tests for women and doing tests.
Well, that's
on
what I'm saying. You
pregnancies.
have a
We wanna-
test,
yeah.
but then there's no ability to have a safe,
Well, but
you know.
there is ability,
Well,
but you
there
have
is,
to get
right.
the training.
No,
Yes.
exactly,
Yeah.
but not access to train, I mean, it's.
Right now, healthcare is dictated by your zip code, and that's especially true for
Yeah.
abortion care. It's true for all our care, but it's
It's always
especially
been
true for abortion care, and it has always been true,
Yeah.
because we have great inequality in our country.
Right.
But I was hired to come to Weill Cornell to expand abortion service. So we have established abortion care services at NYP Queens, where they didn't previously exist, and also at Brooklyn Methodist, because we felt strongly that while there was already abortion care on the Upper East Side, and we could expand that and increase appointments and hire more physicians, we also wanted women to be able to get care in their own communities. You shouldn't have to love Brooklyn, but you shouldn't have to get out of train and come an hour, up to the Upper East Side to get your abortion if you're a Cornell patient. And so that vision has really allowed us to be able to improve and expand abortion care throughout New York City. Working with a team of people, I hired additional physicians. Our commitment is to making sure that women get evidence-based, safe, compassionate abortion care for whatever their reason.
What do you do in terms of pain management?
Whatever you want. There are all options. What I've come
Patient-centered care. Right?
Yes.
It's a
What
novel
I've come to
concept.
understand, I mean, pain is very subjective and we're all highly individual. I could talk to someone about a first trimester abortion and they're like, what do you mean you're gonna put me to sleep? Like, I don't wanna be asleep. I'm petrified of anesthesia. I don't wanna be hooked up to a bunch of wires. Can I take a pill? Can I just do this here in the office? Yes, ma'am, you can. And then, the next patient in the day is like, what do you mean you're going to do this in the office while I'm awake with local anesthesia like a dentist? Can't you take me to the operating room and put me to sleep and wake me up when it's over? Yes, ma'am, I can. Can't you give me a pill so that I can go home and just have this process with like my cat and Netflix? Yes, ma'am, I can. So we offer multiple options for pain control so that women can choose what fits them best. We all have different values, priorities, needs, and I think it's really that being able to provide options is what helps us. I talk all the time about meeting people where they're at, so we have a conversation about where you're at, and then we figure out next steps.
And so can somebody come into Weill Cornell and just say, I'm pregnant and I need to terminate this pregnancy? Because
yes, and then they'll say Garrity, right, Hennessy, or Fogg.
Okay, because in my day it was, there were many abortion clinics and there was Planned Parenthood and then there were all of the people demonstrating out in front and you couldn't walk in and people were throwing blood at you. I mean, it was just like insane.
We are integrated into the regular OBGYN office where I provide
So you're just kind of
abortion
going
care.
in and you're not feeling like you're crossing a line.
No, we have no protesters. And Planned Parenthood does excellent work. So do other
Planned
independent
Parenthood
clinics.
also is set up all around, obviously. I mean,
Yes.
So Planned Parenthood, people can go to a Planned Parenthood and actually have an abortion there.
Absolutely, and people like me are the doctors that are at Planned Parenthood. We're everywhere, but like we will take care of you happily. Your people, your references at Weill Cornell and NYP, and there are many other people doing this work who are also wonderful, compassionate. You will get excellent care at Planned Parenthood.
Okay, so we're talking about the poverty line. So one of the things is that, well, there's two things, and I know we're going to be talking about this, so I don't know if this is the time. Obviously, the states that do not allow abortion, and now someone has to come. Or, I mean, I remember being, 17 or 18 years old and not having like friends giving money to be able to go and have an abortion. So how does insurance work with Weill Cornell and Planned Parenthood? How does that work?
Insurance, if you know one insurance company, if you know one insurance plan, you know one insurance plan. So it's hard to make broad generalizations. About 50% of people who seek abortions pay out of pocket, usually because their insurance doesn't cover it or their copay is too high, right? You choose the cheapest plan because you're just graduated from college and you want to pay $120 a month and you've never been sick, and so you have a $10,000 deductible. And then, depending on what kind of abortion care you want to seek, you're going to have to pay out that $10,000 before it comes back. There are a lot of abortion care funds that help to defray. We at Weill Cornell have received an incredibly generous gift so that we can provide, well, let me just take a step back. New York State, Governor Hochul is kind of awesome. Especially when it comes to this, when the draft of, I don't know, maybe not in other things, but I just, about abortion care.
She's been supportive, which is key.
Incredible, she put her money where her mouth is. So when the Dobbs decision was leaked, she started with the legislature.
Can you tell us what the Dobbs decision is?
Absolutely.
Okay.
The Dobbs decision is what overturned Roe. So for almost 50 years, Roe v. Wade was the law of the land. It was federal protection. I like to do a big umbrella because I'm a visual learner. The federal protection for abortion care. And states could chip away at that and say, we want parental permission or 24-hour consent, because just to make sure the woman knows what she's doing. Because, women all the time are stumbling into abortion clinics and being like, oh my God, what's going on? Yeah, it's infuriating and infantilizing. But when Roe was removed, then states got to decide. And so if you're in Alabama or Texas or anywhere in the Midwest or South, your reproductive autonomy is not going to be upheld versus on the coastline. And what that means is that women are traveling further and more women are having to travel to get abortion care. We provide abortion care for undocumented, uninsured, underinsured women with a combination of funding from New York State, because that's one of the things that Governor Hochul did, She allowed New York funds to be set for initiation or expansion of abortion services. That was right when I happened to be recruited to Weill Cornell. So we've gotten over like 1.5 million from the state in order to hire new physicians, expand care, like I said, in Brooklyn and in Queens, and be able to make sure that women have no cost abortions. An additional family fund, private philanthropy, has allowed us to be able to pay for flights, because New York State can't pay for flights because that becomes an interstate conflict. Lawyers probably know more, can say more about that. But we can pay for flights, we can pay for food, we can pay for your child care back home, we can pay for taxis, we'll pay for your hotel. So it really is going, yeah, isn't that amazing? And that still won't be enough. And I was talking to some friends in the South, and there's data to suggest that women who are in the South will drive up to 13 hours for abortion care before they'll get on a plane. And I travel a lot for work, and I thought, I don't know, and then I went to LaGuardia, and I was like, yeah, I just went to the wrong bathroom. I guess it is kind of hard to navigate these places. So that idea of women coming to New York City to get care is an option, and we are available, and we are ready to help. And many women will not feel comfortable enough to take that step because travel makes it seem really out of reach. In addition to the fact that they're working 2 part-time jobs, can't get time off of work, don't need to do with their 3 little kids. And are trying to keep this from their abusive husband because another baby would just tie her to him.
And to be clear, before we had Roe rescinded by the Dobbs decision, which was punitive and specific, most women in this country still didn't have access to any providers.
Right.
There wasn't a clinic like Aileen's where they could just drop in and say, I need help. For most women in this country, it was completely dependent on which state you were in and whether or not your state legislature actually supported. Roe was not protective. The other thing about the finances,
Meaning that there would not be,
there wouldn't be a provider. There would be so many restrictions.
So there was no abortion clinic, and doctors couldn't do it at a hospital.
Or there were so many restrictions on the providers that they weren't able to access care, even though it was technically legal. It was completely inaccessible.
Where like you'd have a 72-hour waiting period. So you go in, and it has to be in person. You have to get consented by the doctor, the same doctor that's doing the procedure, and then you have to drive back another 10 hours home, and then come back 3 days later in order to have your abortion care. Like, who has enough time to do that?
Most importantly, so that your point that most states did not actually have. Well, we didn't make the point. You made the point that most people who need services are below the poverty line, but only 14 states actually provide for Medicaid funding of abortion. New York is one of them, which is why you can go to Planned Parenthood if you're on Medicaid and get your abortion covered by Medicaid. But in most of the states in this country, you couldn't do that before Roe was overturned because there were punitive policies in place that said if you need an abortion, you got to pay for it yourself, which means for most women it was completely out of reach.
Which is hard to believe, but it's
absolutely
obviously, if you're
true.
talking about the poverty line being $25,000, I mean, and you've got kids at home, and you were talking about being in Texas. So the other thing was, we were talking about, okay, so all, any of this in terms of being filmed, and if you have any friends and that have daughters, because you need to pump this out to the girls and any woman that's getting pregnant, but in terms of being in the states where it's illegal. So if you're in Texas and you help someone, you pay for someone or help someone or know someone that flies to New York and comes to you and has an abortion and comes back, there's legal issues with that, right?
Yeah, I mean, there's potentially, the biggest legal issues is probably for the individual woman. Texas also has a vigilante law.
This is great.
Right,
Listen to
which
this.
is like,
This is so sick.
the state will pay $10,000 for someone who turns in a person who has aided or abetted abortion care. So that could be the individual. There was a husband that sued his wife and her 2 friends who helped her travel out of state to get an abortion. He dropped the suit last week, but he said he didn't know and that this was, all of those things. New York State has shield laws to protect people like me. So if I take care of anybody from a different state, we won't know if those shield laws actually are a shield or if it's a see-through shield until I get sued or someone like me gets sued. And the thing about abortion bans is that they are criminal. So doctors, because one of the things with the, the exceptions or, for life and health of the mother is that, again, they're not written by physicians. They're not written by people with any experience in healthcare. So it is unclear what needs to happen for someone to get an exception for life and health of the mother. And if you are wrong, if a physician is wrong, then a criminal suit will be brought against you.
Right.
Malpractice insurance does not cover a criminal suit. A criminal suit is saying that I've gone outside of anything that is normal or regular in healthcare, and so then it's jail sentence. We can't get insurance for criminal, like the system, when Dobbs happened and Roe was overturned, 50 years of a healthcare system that was imperfect, still very much benefiting of people with more resources, but that little has been taken away, and it is the wild, wild west. And so when people show up to an emergency room in Texas at 18 weeks with their water back broke, no hope of the pregnancy continuing, no hope of a live birth at that. The only reality is infection and potential death for the woman. In Texas, if the heartbeat is still there, then she will not be able to get abortion care until she's on death's door.
The doctor's hands are tied.
The doctor's hands are tied.
And there's a concept in most of these banned states of exceptions. Right? And this exceptionalism just creates more stigma and more confusion, because the states that have bans actually have language that includes exceptions for substantial impairment of a major bodily function. Now, this is so vague, right? And the people who need to interpret it tend to be the attorneys, not the medical professionals. The medical professionals who work for hospitals are being told they have to listen to the attorneys to decide what the exception should be. Ultimately, all this exceptionalism just provides coverage for the legislators who make the laws and makes it impossible for us to actually take care of our
And this
patients.
is midnight on a Friday night in the middle of Texas.
It's every day,
Yeah,
all
like,
day,
good-
everywhere.
good
in the
luck
world.
with that.
Everywhere.
Good luck. You can't
Everywhere.
even- yeah,
Everywhere.
okay.
I mean, since pregnancy is riskier than abortion, always, then exceptions don't make any sense anyway, right? The whole concept of an elective abortion is so misleading,
Yep.
since pregnancy is always a time-sensitive, life-altering condition. But I think that the idea that you could actually criminalize pregnancy now has been taken to extremes since Dobbs, because you have so many states now where actually violating the exceptions can make the physician subject to criminalization, and it puts the healthcare providers in a position where they might be thinking about themselves instead of their patients. And
How many have you seen, or I can't imagine that this is not the case. I think, are there less and less people going into medicine in the first place, but certainly into gynecology and
we already have
OBs?
data that medical students are choosing not to go to states that have bans, that 76% of medical students interviewed 6 months after Dobbs said that they wouldn't go to any banned states. There are downstream effects of healthcare bans, right? This is normal healthcare that's being banned, criminalized, and subjective to civil litigation. So already the programs in the states with bans are suffering a 20% decline in applications for their residency programs. If Aileen had trouble getting training in New Haven, Connecticut, which is the origin of much of our contraceptive and abortion legislation, you can imagine what it's like in half the states in the country.
Because it would be illegal for medical students to be trained in that, because it's
Right.
illegal for physicians to provide that. So you could do simulation training, but that's not the same.
Right.
And so what we see is medical students voting with their feet. And so undergraduate and then medical school.
residency.
And then residency, which is when you train to be an OBGYN, a huge shift in applicants to residency choosing states where abortion is protected and they can get training, because medical students and soon to be residents understand that in order to be an OBGYN, you need to take care of all of a woman, no matter what she needs when she comes to you for help. And so what that means is that these red states with abortion bans are going to have less providers, even if they were to overturn those laws. And again, the people that will be most impacted by that will be the most marginalized.
But this affects everybody. It's not just OBGYNs. Obviously, it's devastating for us because our profession is being decimated by these laws. But the majority of healthcare providers, whether they're doctors or the people who clean the floors in the hospital or the people who admit you when you come to the hospital, or the nurses, they're people who are capable of pregnancy. And no one wants to build a life or train or make their future in a place where they can't access evidence-based healthcare. So what we're doing with healthcare bans, because abortion is normal healthcare, is actually creating huge healthcare deserts throughout the country. There are places where hospitals are closing. It's not just the maternity care facilities that are closing. Entire hospitals can't staff because people are afraid to live there. They can't work there. So it's going to impact everyone, not just the women that need abortions. And that's the part that people don't think about when they start banning healthcare. So on that happy note, I would just say very simply that, there's no good abortion or bad abortion, right? All pregnancy care is for medical reasons. Abortion is always medically indicated. There's no such thing as elective abortion, right? So we've learned that talking about abortion can be divisive, but I think that we have to stop internalizing all the stigma and shame over this really common procedure and start speaking about it instead of thinking that it has to be something controversial you can't discuss. You've got to talk about it publicly. We've talked about how the restrictions have downstream effects that impact everybody, and we know that forced births actually lead to more devastation, whether it's increase in preterm delivery, low birth weight, an increase in maternal mortality, there's an increase in intimate partner violence, and there's economic costs, right? Because forced birth intensifies financial hardships, and it creates more deprived children, more welfare, more poverty, less education, more incarceration, and more need for social services. So you can't say that you're pro-life when your policies ultimately endorse medical chaos and death.
Can I just jump on that? I mean, I
Sure.
think here's the other thing for the next time you're sharing a taxi with someone or whatnot. I really push back on this idea of like what it means to be pro-life, because the states with the bans, with abortion bans, are also states that did not participate in Medicaid expansion. They have the highest poverty rates, lowest childhood education rates, highest maternal morbidity and mortality. It's a lie. Because if what you really were was pro-life, then we'd have universal health care, we'd have universal pre-K, right? College would be affordable. So when you hear vice presidential candidates talk about how they're pro-family, let's see those receipts. Because it's not like their policies are uplifting things on the other side that really make it attainable to have the number of children that you want. And to have the government support that. We have no daycare. We have no child care, right? Hodgepodge that people who choose to become parents go through between when you have your maternity or parental leave and then when they start school, the thousands of dollars. Childcare isn't affordable. You're basically paying your own salary to be able to have someone else to take care of your children because the government is not pro-life.
No, not at all, not at all.
I get fired up.
Can you tell us about, so that we understand what Proposition 1
Yes, we're going to talk about some of the things that you can do, right? Because we really want to be sure that, we can dream about having a federally supported public health infrastructure, but I don't think that's really going to happen next month, right? We can't do it with our Senate, and we probably can't do it with the structure of our so-called democracy. But there are some things that we can do imminently. So first of all, just imagine a world in which women actually get what they need. And then I want you to think about what you can do in a few weeks, which is to make sure that if you're voting in New York State, that you turn over your ballot and you look at the New York Equal Rights Amendment, which is the first proposition on the back of your ballot, and simply vote yes. It's not controversial. It just states that we all should have equal rights and that we shouldn't be discriminated against on the basis of our pregnancy or pregnancy outcomes. The word abortion, unfortunately, isn't even in there, which is why I have to wear it on my chest every single day, because the politicians will say it.
So that's not Proposition 1.
It is Proposition 1.
Okay,
It is a measure
so it's going
that-
to say Proposition 1, or is it going to
Prop
say
1?
Prop 1?
But
Okay.
basically, the language is simply to ensure that it's part of our Constitution that everybody's entitled to equal rights.
And
It
this is
shouldn't
the
be
state?
controversial. This is New York State.
Right. Okay.
And
Yes on Prop 1.
yes on Prop 1. Turn it over, vote yes. It's very simple. And if you forget, then take the little cards on your table
See
and
the blue
take some
cards.
buttons and make sure that everybody in your workplace knows about it. because it's shocking to me how few people in New York City who actually know that they want to support the ERA and understand how important it is to put abortion rights into our Constitution have no idea that this is actually on the ballot.
You know, I just, abortion rights, it's freedom of choice. It's pro-choice. It's like, it's so, because I think when it's like as though anybody would want to have an abortion. You don't want to have an abortion. There's no
I wanted
woman.
to have an abortion. I was happy to have a few abortions.
No, but you know,
Abortions are good.
No,
Abortion is a source of
but hold
democracy.
on.
It's possible.
You don't want to be.
I don't want an accidental pregnancy with an IUD in my uterus. No,
No,
but
no,
if you have that and you're 20, you want an abortion. It's
Exactly, but you don't want to find yourself being pregnant in the first place. It's just upsetting. But I think the whole choice of the whole point about choice, it's just choice, because I think to think that you're just that a woman goes into this and doesn't have any feelings about it. I mean, I had feelings about it. I felt very sad about it. I didn't want to have a baby. I was afraid. I felt embarrassed and
your experience is important, but I think what we want to do as providers is make it clear that anyone else's opinion about your experience is irrelevant.
Exactly,
right?
but it's a choice. It's
Yeah.
a choice. That's what I'm
It's
saying.
not always a choice if you can't choose it. So for most women, there's no marketplace of choices when they're pregnant. Adoption isn't an option.
No, of course.
Or an alternative to pregnancy and childbirth. It's an alternative to parenting. So presenting that as a choice is not realistic. What we have to do is really acknowledge the actual medical carnage of pregnancy. And I think that actually because we've lost the right, and many people didn't have it to begin with, but because so many more people are conscious of the fact that we've lost federal protections for abortion and for the medical care that we need, people are actually getting a really serious education in obstetrical complications.
Right.
An unwilling seminar on really the carnage of pregnancy.
In terms of what? Because they can't
What
terminate the
pregnancy
pregnancy.
can cause for you in the long run. I'm sure there's not a woman here who's ever had a pregnancy carried to term who doesn't feel that it changed her life irreversibly. And if somebody thinks that it did, please let me talk to you afterwards. I really want to ask you some more questions. Because every pregnancy is a health threat. Every pregnancy alters your body permanently. It's not something you just do for 9 months, drop the baby, and then leave.
Right.
It's not over when when the baby's delivered.
And we know that about 1% of people who choose to continue their pregnancy will choose adoption. It is not common. It is not natural. I'm an adoptive parent. It is not what most people will do, because as you go through pregnancy, you bond. As you go, and there's no social, there's nobody lauding mothers who have chosen to make an adoption plan. That's something that's stigmatized. It's something that's not talked about, and it's not the reality. I mean, the only reason adoption was so common in the 60s and 70s is number one, because there was no abortion, and number two, because women were forced, right? Women were taken to their aunt's house or the convent or the whatever and forced to make an adoption plan. And that's kind of what we're going back to, because forced births, forced carrying to pregnancy, and then it will be forced adoptions. And I think the other thing, getting back to what Chris was saying, your chance of dying with pregnancy at full term is about 20 times higher than it is with abortion care.
And that's just dying. That has nothing to do with all the pregnancy complications and the long-term effects, of which there are almost none after a safe abortion.
So what we see now is that maternal morbidity and mortality in Texas, we're using this as a case study, and neonatal morbidity and mortality went up. Because if you have a baby with trisomy 18 that is not going to survive, past, outside of the utero, then you are walking around for whether it's going to be 7, 8, 9 months with a baby that even if you wanted to be pregnant and you wanted to be a mother, that is not going to result in a baby that you get to take home. That kind of delivery of not being able to access abortion care is absolutely cruel for the people that have to live it. The legislators don't have to live it. The legislators have no idea. The legislators in Ohio were like, you should take that ectopic pregnancy, when a pregnancy is outside of the uterus, and put it back in the uterus. I was like, amazing. Don't you think we would have done that for the last 40 years if we could have? Like, it's not a thing. It's not something that can happen.
It's not a thing.
It's not a thing.
Jan, you work in this field.
I do.
And so I just want to be able to kind of introduce you and just tell a little bit about what you're involved with and how you're helping.
I'm Jen Richard-Toms.
But just stand up, because I don't know if everybody can hear you. Sorry, go ahead.
I'm Jen Richard-Toms. I'm the Managing Director of SAN, which is a really cool acronym that stands for State Abortion Access Network. And we are actually a membership-based organization for advocacy organizations fighting the good fight as it pertains to making sure that we have access to more access throughout the U.S. It is really a critical moment in time. And there's nothing else I could say because you both said it so eloquently. And thank you so much for the...
Is it something that needs funding? Because I also want to ask you too. We want to make sure that we're putting our money where our mouth is, and we need to be able to help here. So
Yeah.
is it so
Yes.
just
Yes, we need money. We're
so how exactly do you work? Like just
Yeah, so we're in 12 states. We have 10 members right now. We launched earlier this year. So we're in Texas and Missouri and Ohio.
so what would you do in
Those are
Texas?
all states with bans.
So all states, well, red states, blue states, purple states are also in states like Massachusetts. So we support each other, and states work together to help each other get through all the shit that's coming their way as it pertains to everything from ballot measures to pregnancy centers, which are fake pregnancy centers, to everything in between. A lot of voter registration, get out the ballots, working in as clinic escorts in different clinics as well. We need money because it's really hard right now, no matter what state you're in, for these organizations to raise money. If you're in a blue state, the perception is you don't need the funds. If you're in a red state, the perception is you're too late because you're in places like Texas, and how can our monies actually go to support the work that we want you to do? We fund about 80% of our overall operating budget goes directly to our member organizations, and there's no other national structure that can say that they allocate that high percentage of funding. So we support our organizations through cash grants, we support them through products and services and technical assistance and capacity building so that they can ease the operational burdens that they face so they can do more outward advocacy. I just want to also say this, so in addition to writing the checks to us, which would be brilliant, as we know, we're all going to vote, and we all have to keep in mind that we live in a bubble here in New York. But with that said, there are also races happening in New York State that are really important. For example, Long Island, Westchester County, which is where I live, that no matter where you live in the state, you just have to vote up and down ballot because local races affect
Yes.
Everything.
outcomes that we're talking about as well as do national and state elections as well. And I'm happy to talk to anyone who wants to have a conversation about this. Thank you.
I also need money.
Exactly. So
We would like to have, we will be starting a complex family planning fellowship at Weill Cornell, New York Presbyterian, yes. So that we can train the next generation of people like me and Dr. Creature to go out and be able to provide. And so that is something that, so this would be training for after the OBGYN residency, training in later care abortion, really sick people. We are the safety net for like Planned Parenthood. So if someone's too far along for Planned Parenthood, too sick, really needs hospital-based abortion care, that's what we do. So my email is I think on the bios.
and we'll send it out with the links.
Yes, and I would be happy to talk about
And is there any
anything.
volunteering that anyone can do? I know that we talked about this, and I know, listen, we have to give money. But when somebody's coming in from out of town, I mean, I can't even imagine the
I don't
the
know,
fear.
you want to make bread or something? Yeah, let's do it.
Like, no, if they
I like
need,
banana
if they
bread.
need a place to stay, or
Yeah.
they need, I don't know. So, but you're saying that you have that covered.
We do. We have that covered. We have the hotels picked out. We have the, and taxis and Ubers and things like that. But we are about to start advertising this. We've been building our infrastructure because the worst thing about calling and being like, I heard you can help me. And then us being like, but we don't have OR time, or we don't, we don't have enough doctors. So now we are staffed up. We have protected OR time. We have the infrastructure. And so we're going to start to advertise first to our colleagues in New York City, New York State, and then nationally. And that money will go quickly because to have an in-hospital abortion is about $20,000.
Can you also talk about, I used to work with Planned Parenthood of Indiana and Kentucky, how those
Thank you.
those Planned Parenthoods don't have any money now to do regular reproductive health care
Yeah.
for women because of all these laws.
Yeah, so Planned Parenthood does more than abortion, right? Pap smears, mammograms, etc. And they, in states that red states as reproductive rights have come under attack, there's been all kinds of campaigns to prevent state budgets going to places like Planned Parenthood, because Planned Parenthood also provides abortions. And so they've had funds withdrawals. All those red states have had all the RAGE donations. Thank you. Anybody in the audience? RAGE donations.
When you get mad, you send
Upset
money. Okay.
women
Okay.
after Roe fell, who sent money to like national abortion funds. That money is now gone. Right, that is money that's been sent over the last 2 years in order to get women the care that they needed. If you are originally from Alabama, there is the Yellowhammer Fund. You can give at a national level to help people get this abortion care. You can give to Weill Cornell, where I got this great, my husband is an architect, but probably should have been a graphic designer. I have a fascination with the Statue of Liberty. I see my calling as like, bring me, you're tired, you're poor, you're huddled masses, yearning to breathe free. I will give you abortion care with a smile on my face, a hug, and like all the best wishes. And so we are raising money for that. But if you come from a place other than New York City, or you have an affiliation, maybe you feel more called to give to the women of Alabama, the women of Texas, etc. There are abortion funds
All over the
everywhere.
country.
And that is to directly help people get access to the care that they need, which will also often mean traveling, and is just more money than you could possibly imagine. As I said, $20,000 for an in-hospital abortion.
But it would be really nice to make these abortion funds not necessary by making sure that you only support legislators who actually aren't misogynists. That's really simple. You have to demand that they're not being misogynists, and you have to make sure that if you have the ability to use time, that you are phone banking in swing states, that you are phone banking regular local elections, so that you know that your legislators are not willing to throw us under the bus, that they really care about providing comprehensive health care. Because that actually is really the helpful thing to do if you have any extra time. That's the most useful thing that you can do right now.
And you can all be truth tellers, right? You all have more information. You already came here because you were interested in this. Push back on misinformation. You know that 1 in 4 women will need this care, that we spend 30 years of our life trying not to get pregnant, and that 90% of abortions are done in the first trimester. So if it's a conversation over the water cooler or not, feel empowered to be able to tell your truth and to share that with people, especially if they live in a swing state.
And to remember, it's not really just 1 in 4 people that's affected by abortion care. It might be 1 in 4 people who's actually had an abortion or been able to get
That's
one.
right, yes.
But I think everyone is affected. So if you don't believe me, go and talk to the people in your family. Ask other people in your life who are important when they were impacted by abortion care.
Or you can ask each other at the table.
And ask the men in your life to go into their history and think about how they got to go to Yale Law School because their mother probably had an abortion so that she could send you there, right? To really think about why you ended up on the Supreme Court ruling against women's rights. Because maybe someone in your family had an abortion when she needed it. To think honestly about how abortion serves you. Because as a doctor doing this for 4 decades, when I talk about what I do, people tell me their stories. And then at the end of their story, they say, and you're the only one I've told.
Yeah.
And that is the most upsetting thing to know, is that they don't feel that their story is important to share with the people that can control their future. So make sure you know your history, that you know how you're an abortion beneficiary, that you understand that every person walking this earth has been impacted by someone else's pregnancy care. It's really about pregnancy, not just abortion.
That's right.
And to learn how that's made you the person that you are, with the freedom that you have, to have the career that you have, and hopefully the healthy life that you have. And don't let anybody tell you that it's just a social issue.
And just to piggyback on that, I'd like us all to be familiar with the concept of reproductive justice. So reproductive justice is a framework that was developed by Loretta Ross and Sister Son, a collective group of Black women in the South, who kind of in answer to pro-choice, et cetera, were to say that it is about more than that. It's all pregnancy-related care, and it's the right to have children when you want to or not have children, and the right to raise those children in safe and healthy environments. That, you know, we're talking about abortion care because it's stigmatized and gets marginalized, but really what we're talking about is supporting all of pregnancy-related care so that we can get what we need. Imagining a world where women get where they need.
Yeah. There you go. Anybody have any questions? Because we're going to go to a Q&A. Jill,
Well,
stand up, sweetheart.
okay. First off, I was very, very moved
really nice.
Yeah.
I don't know, you're a wonderful, both of you are wonderful speakers, and
Right back at you, Jill. Right back at you.
but this is I just was wondering, what about male?
Contraception?
Yeah, why don't we focus more on that?
Sperm's weird is the answer, but there's two PhDs at Weill Cornell that have been working with kind of a different way. Women are born with all the eggs that we're gonna ever have, so for a pregnancy to occur, egg and sperm have to come together. So ours are just sitting there. Men are constantly producing new sperm even when they're old, and so the pathway to kind of block that is different. It is coming, it is slow. One of the pushbacks on male contraceptives is that women didn't want to rely on their male partners.
No.
But we need both.
But men don't actually suffer any of the consequences of failed contraception. So unless it was totally random who got pregnant when you had sex, which would be awesome, right? Then it doesn't really matter. I mean, the most important thing is that we hold the power to produce human beings. And because we hold that power, it's actually threatening to other people who don't, which is exactly why the legislation happens the way it does. So we have to use that power and understand that when pregnancy happens, it really only affects the person who actually got pregnant. It's her body that it impacts. It really doesn't affect men in that really acute way. So I don't think male contraception is the answer. It's one of many options. No one here in family planning would ever say we want to decrease options.
No.
But it's not the solution to the problem.
Raina,
So I increasingly hear about.
just stand up, I just don't know if everybody can hear you, sorry, go.
I increasingly hear about potential legislation to regulate women's cycle and monitor it and notice like when she's ovulating and the like, and it sounds like very dystopian and scary. So I was hoping you can talk about the status of those efforts. Has it gone into effect anywhere? I think I even read a story about like a place where women might have to agree to have their cycles monitored to participate in sports the way they use drug tests. So all of this seems just like, I can't even believe that this is our country, but can you talk about the status of that, please?
Yeah, I mean, I think this is more than about abortion, right? They're coming after contraception. That's what all this talk is about, the Comstock Act. They're coming after IVF, right? They already did. They didn't even know what they were doing.
Sorry, can you just,
Yes.
what is Comstock? Sorry.
Thank you. I'll just say IVF is in vitro fertilization, so assisted reproductive when therapies, when someone can't get pregnant, just by having sex, and the egg and the sperm need to be put together and then put back into the uterus. That came under attack by legislators who said that these are the things about personhood bills, so that when that egg, there's, for people who say that life starts at conception, which is, again, the logical argument is untrue, because that would mean that the 5 embryos I have on ice in Virginia are people. It would also mean that I was already pregnant, which I would have loved if that happened, wasn't in the cards for me. But those arguments that when the egg and sperm come together, it's a life, then that impacts IVF, another part of our reproductive health care. What they're saying is that you can't dispose of those embryos. So those like 8 cells that you have because you froze your eggs when you were 30 and you hadn't found a partner yet, and then you get pregnant when you're 40 and maybe you wanted to have 2 children, so you did, and you still have 5 eggs or 5 embryos that you couldn't dispose of them in a ethical manner because they were people.
And the only purpose of these laws is to create this concept of personhood legally. It has nothing to do with what's going on medically.
No. And it's only to control us.
And what was Comstock? What were you talking about?
Comstock, well, this is fascinating. So Comstock was this crazy guy, you can Google it, it's fun for your cab ride home, it was an anti-pornography legislation from the 1800s that said that you couldn't mail anything that was, quote, pornographic, which also included any information about contraception or any kind of birth control.
It was obscene material.
Yes, obscene.
And it's never been taken off the books because nobody took it seriously enough. But now that we have this possible Republican administration with a total fascist wacko prevailing, it could actually be used to keep us from mailing abortion pills around the country. And
It could
other
be used
things
for saying that you can't have access to contraception.
at all.
It could be used for saying that you can't have access to IVF.
It could be used for basically anything that anybody wants it to, because right now we have a Supreme Court that's totally rogue. Did somebody call them a bunch of partisan hacks? I think it was one of the partisan hacks.
So what Raina was asking in terms of the cycles, like, I don't know what you're talking about.
Yeah.
So what is,
I mean, right, if the government is policing our bodies, if they now have the ability to do that,
And they do.
and they do.
okay, so how
Then how is that gonna
how
be-
do they? I mean,
So
in
you
terms of the
download
cycle.
like Flow, like let's say Flow is an app. You want to track your cycles. I mean, back in my house in the '80s, there was like a calendar with Ziggy on it, and I wrote AP for Aileen's period, and my mom wrote P because she was the first one for her period, so we could track our cycles. It was like there on the family calendar. Apparently there's new technology. And so people, like we do everything else with our phone, you can track your periods on that phone. Well, who gets that data? Who is that really private? And what if the government does want to track when you're cycling? And there is the potential for really broad interference in some of the most personal things of our life. And there is talk about that. And this has been going on even before Roe fell, to the point where, like when Twitter was first happening, I forget, there were some legislators who were trying to, regulate various things at the state level, even though Roe as the federal protection was still there. And so young women just got on Twitter and like, I have a really heavy flow today. Do you think I should use a super tampon or a regular? To say like to these legislators, if you want to be in,
Right.
if you want to be in this with me, oh, you're going to be in this with me. And then like sending them pads to their office and tampons and like heating pads.
Because there's a
yeah.
lot of surveillance opportunity, and there certainly is already a great deal of surveillance of pregnant people. If you use your phone and you start searching for certain things, you can actually be surveilled, right? We know that advertisers do it, so certainly it would be easy for the government to do it.
I still don't trust Alexa.
Sorry, go ahead.
I have a question about, we're all a seemingly like-minded group, and I love what you're saying, but what are the organizations or groups of people that we need to be thinking about who don't have the beliefs you have? And I appreciate the bullets you shared with us to share, but what, I can talk to people I agree with all I want, but who should we be talking to try to understand?
We have to get people to vote.
Well, but I think it's good to engage people in religious organizations, which are, ostensibly benevolent organizations who care about the health and welfare of their members, and to really try to get people who have leadership positions and who have the ear of large groups of people to talk about what is a benevolent policy for your institution, right? There's nothing about being religious that is against having abortion care, right? I mean, hopefully being religious makes you compassionate to other people. What you have to do is reframe the conversation so that it's not about stigma and shame. That's how we start talking about it, is to make somebody really understand how this ability, this freedom serves you, not how it hurts you.
And I would say I try to find common values. And then, so when we were expanding abortion care in Queens, some of the nursing staff has been there for 30 or 40 years, and they were like, I'm Catholic, I don't believe in abortion. And I was like, yeah, I was raised Catholic too, I get that. And I actually do this because of my Catholic faith. Like, if not me, then who? If not now, then when? And that this is about the people we're serving. And so I said, look, you've been caring for the women of Queens for the last 30 years. You care about your community. Right now, when women in your community need this care, they have to go elsewhere. Don't you want to be able to take care of them here? Don't we want to be the kind of place that like welcomes your baby and then helps you with your abortion care and then helps you with your tubal ligation and your menopause and everything else? That really it's about individual people and their own beliefs, and that kind of honing in and capitalizing on the fact that we all care about the same people, and that it's really these individuals getting to make that decision, not what you would do yourself, because that's kind of irrelevant, I have found that to be a very helpful strategy. So whether that's about like freedom, I mean, the Republican Party is supposed to be all about big government, except when it's in your uterus, apparently. But, you know, whatever it is, whatever group that you're in where you share those common goals, I found that to be a really effective strategy to have conversations that would otherwise be, you know, kind of incendiary.
One more question, sorry. Sorry, go ahead.
No, I was really gonna.
It's okay.
I actually have a story about Roe versus Wade that might be of interest. I went to law school in Texas, Baylor, and graduated in the early 80s. And one of the ladies who came to speak to us was Sarah Jane Weddington, who argued Roe versus Wade before the Supreme Court in 1972. And she said, when I got out of law school in Texas, I think it was like the 60s or the early 70s, I went around to Dallas and Houston and San Antonio looking for a job. And they said, well, we don't hire women. We'll give you a job as a secretary. And so she said, the only place for me to go was the government. So I went and worked for the state of Texas. And that's how she ended up arguing Roe versus Wade at age 26 in front of the U.S. Supreme Court.
Wow.
It was a job nobody wanted.
Right, and I feel like I've heard her speak many times, and she said they gave it to me because they wanted me to fail.
That's
And
right.
she had a different idea about what was going to happen.
She died just before it was overturned, unfortunately. But
Love that. Yeah.
I'd like to make a
Sorry.
Oh, I'm so sorry.
Oh, no, that's fine. My name's Azalea and I'm with Legal Momentum and we work on reproductive justice. And I wanted to thank all of you.
Where do you work? I couldn't
Legal
hear.
Momentum.
Oh, thank you.
And I wanted to thank you doctors and Annie for having this evening tonight and raising awareness on these issues. And I think my question for the doctors was, how do you keep going in light of all this? I mean, we're arguing, you know, the EMTALA case in December. We did an amicus brief in support of the physicians and everyone who's providing this care. And I can't believe that here we are, you know, debating whether pregnant patients can get emergency care in America in 2024. The mifepristone case, you know, and these cases of the Supreme Court were dismissed on procedural grounds. It had nothing to do with the substance of the cases. And then they're just going to come back.
Kick down that road. Yeah.
How do you, you know, keep going? And thank you for doing what you do.
Let me just say, I think the legal work that's being done is important, and I don't want to discredit what attorneys do because they do try to protect us as much as some of them try to harm us, right? They're not all on the same side. But I think really the future has to be, we have to dissociate and liberate abortion care and pregnancy care from the legislative process. That's what we really need, because we perform abortions for Republicans, people of every religion, people of every single economic level, people who think that they're anti-abortion until the day they need one. Everyone needs them. So we don't discriminate against who they are. We just provide it because that's the just thing to do. So if we could just extract ourselves from the legislative process, we could do our job. That would be ideal.
That would be ideal.
And I have any credit.
Those exceptions are bogus, because by the time you get to the
Yeah.
police and report that
Doesn't
you're
mean
a victim of rape or incest, it's too late, and you're in a banned state, and forget it.
I was raised by women, albeit in the Catholic, you know, whatever, there's some good stuff. But I just believe so strongly in like people's individual autonomy and the empowerment of women to be able to create the lives that they want, that this became, I wasn't sure when I started medical school. I was like, I don't know, I was like, I'm from Scranton, Pennsylvania. Casey versus Planned Parenthood. Casey was the governor of Pennsylvania who lived across the street from my best friend growing up, like his home was in Scranton. Every homily every Sunday was about abortion, because this was when I was in high school when the Casey course was working its way through, and I was just kind of agnostic about it because I wasn't like personally affected. I had friends who were going from Scranton to Binghamton to get their abortions because it's like 45 minutes, and I just thought like none of this is making sense. Like I'm just seeing pockets of it. But I really strongly came to believe that my job, my mission, is to help elevate people, and that they're the best purveyors of of their own decision making. Again, I know that women are smart and thoughtful. People still come to see me for their abortion care and they're like giving me all their reasons, and I'm like, look, if I had a billboard, no one's ever gonna give me this billboard, but it would say like, if you don't wanna be pregnant, I'm here to help. Like, right? Like, that's really all it is. So I feel like that's what keeps me going. And the thing that hurts is how many times people meet me and, you know, I'm kind of, this is who I am as a person. I'm like a Labrador hopped up on cocaine. Like, I'm a lot. But people are like, I didn't know you would be so nice. I didn't expect.
Because we have legislators who are stigmatizing the work that we do, and that just encourages violence against us. So I didn't know you would be so nice.
I didn't think you'd be that nice.
Oh my God.
And I feel very strong. I love delivering babies. Like, you know, it's super fun. Like, little person comes out, you know, like high five, sing happy birthday. It's wonderful. It's fantastic. There are so many people that do that well. I wanted to provide the same compassionate, you know, intimate care for people who needed abortion care, and that needing that abortion care, whatever that is, that journey, I'm happy to be part of that chapter in your book, for whatever way you need me, for whatever time. And I find great satisfaction of just being on that journey with people. So that's how I keep doing it.
We're so lucky to have had you tonight, but we are so lucky to have you just as two women that are just bringing just good and positive and love and compassion and empathy to a dark time in our lives. But thank you for doing what you do, because it's not easy. And the fact that you would have anybody not thinking that you're great, but also in any way threatening you is horrifying.
We are very lucky we get to do good work. So thank
That's
you for
right.
saying that. We feel it's a
No, really,
privilege.
but thank you so much.
I'm here to make good trouble, like John Lewis.
Thank you.
Thank you. I really appreciate it.